Hey everybody, I'm Michael Hyland. I'm a doctor of physical therapy and I own Hyland Physical Therapy and Wellness in Broken Arrow, Oklahoma. And for those of you who have been following Wellness Wednesday Live for several weeks, you'd know we've been covering self-treating low back pain and kind of the various steps that are involved with that. And for the past 3 weeks, we've covered what I called getting to the core, and that was kind of beginnings of core exercises and things to stabilize your low back and kind of shore up those muscles in there, because those deep muscles will get weakened with even the first instance of low back pain. So it's very important to address that. Now that we've covered that for 3 weeks, this video today is going to cover kind of the next steps on how you can really challenge yourself once your core is more stable, once your core muscles are more toned up, once your low back stability is improved. We want to actually work on hardening that, right? So we want to go from a maintaining maintenance phase kind of thing to kind of progressing that to the next level, to get you back to the activities that you really need to get to. And that's going to vary per individual, obviously. But I want to show you a couple things that you could try. I think that these would be really good exercises because they're challenging. They're challenging for me, so I know they would be challenging for somebody who's recovering from a back injury or a similar problem. So for some reason I can't talk today, you guys. My words are kind of going weird, so I'm just going to start moving, and then we'll let the video take its own course. So behind me I've got a yoga mat on the floor, and I actually really love this mat, guys. This is not what this video is about, but I like this mat so much I want to put a Amazon affiliate link to it in the comments below, because I really like this mat and how thick it is. It's super comfortable. And this floor is solid concrete, so if I were lying on this I'd be pretty darn comfortable. I have another yoga mat that's about as thin as a piece of paper. Not quite, but you know what I mean. It's really thin. This one's nice and thick, and it's by Hemingway. I really like it. So anyway, what I wanted to show you first is pelvic bridges is a great exercise to do after having a back problem. It's just a great core exercise. It's good for the lower body and the strength there. But can you take that to the next level? As a PT, I can tell you there's always a way to make it more challenging. I'm trying to think of the best way to do this. I think that's a good angle right there, I think. So I would say this is a great exercise to try if you've already been working on core stabilization exercises for several weeks, because this one is going to work you a little bit. So first of all, let me just show you a pelvic bridge in case you're not familiar with that. So pelvic bridging, you're not using your upper body for support. You're going to gently pull your belly button towards your backbone. So you're kind of holding that core solid and then lifting your bottom until you're like a bridge here. You're kind of straight up and down here and then back down. That's a pretty good exercise to start out with, but I want to show you how to do bridges with marching while you're holding that solid core. So this is a more advanced exercise, not for the early days of rehabilitating after a back injury, but this is a great way to challenge your core in a different way. You're trying to get some more advanced positions and movements. So arms crossed. Again, we're going to do a gentle contraction here, pulling that belly button towards your backbone. Hold it solid, and you're going to lift. And now we're going to do a march on this leg, and then the other, and then lower. Okay? And we're going to hold it in. We're just going to keep holding this contraction here with that belly button retracted back a little bit. Lift, march, march. Now I can tell for some reason I'm having a little bit more trouble on my right side. Probably need a little bit of strengthening on that right side. And then lower. So repeating that several times. You might even just start with 5 of them, because it's going to be challenging enough that you might even be a little red-faced. You're trying not to let that pelvis rock from side to side when you do those marches, and sometimes you have to really hold that core contraction tightly. So you're trying to do several things at once. You're trying to hold in your transverse abdominis muscle with that belly button retracted a little bit. Trying to lift your bottom, hold that, and then do the march without dropping down or losing it. And you're trying to breathe at the same time. Don't ever forget to breathe. But anyway, it takes practice. So I'm going to show you one more exercise. I typically try to do at least two. This next one's a totally different position. So we're going to be sitting. I'd recommend using an exercise ball. I got to go grab mine. Like this one. So I also really like this ball. There's nothing particularly special about it, but if anybody's looking for an exercise ball, this one's really affordable. And just realize this is really crooked. That's a little better, I think. All right. Now, so this one, we're going to be engaging the core, but we're going to be combining it with movement and balance. Okay? So previously we've been engaging the core. I'm still crooked, but I'm not going to worry about it. Apparently my tripod wants to do a drunk lean today. All right, so once you're seated on the ball, you could take something simple as this is a 3 pound, but you could do 1, 2, 3 pound hand weight. So we're going to do upper body diagonals combined with keeping a solid core while we're sitting on something that can move. Not only that, but I'm going to only have weight on one leg. So I'm going to kind of hold this core contraction, balance. So I'm holding this one leg off the ground here. All right? And so we're going to combine trunk movement and all these other things at once. So this is a great exercise and really challenging. So you see I'm rotating through the trunk, but I'm holding my posture upright. I'm not hunching over or leaning back. Straight up and down here. Whoa. See, I'm trying to balance at the same time. There we go. You can kind of see, I've got so many balls up in the air here, so to speak. Juggling several balls in the air. But it's just challenging for all those different muscle groups involved. So this is called a D2 diagonal pattern of the shoulder. I'm going to switch sides here because this leg's getting tired. So there's just multiple components to this exercise. And, did I make this up? Probably not. I've never really done this with many patients, but giving me some ideas for if I have somebody that needs a challenge. It is really hard on this side, y'all. So if you see me struggling, there's a good reason for it. Apparently my core stability isn't so great on this side. Not to mention just general strength on my left side, which is my non-dominant side. Oh, I'm all over the place. But you know what? It doesn't matter that you're wiggling all over the place when you do that. It's challenging, and you will get more solid with it practicing it. And that's the main point, is you're just trying to find ways to challenge yourself once you get to the point where the other exercises have become easier. You're not in pain anymore, and you're trying to get back to normal life. You can't get back to normal life just doing a few bridges every day. I should say you can, but you're not really preparing yourself for kind of those difficult activities, functional activities, sport activities, things like that. So gotta take things to the next level and kick it up a notch. That's about it for today's video. We ran a little bit long, but appreciate you watching live with me, and I will post this video to YouTube hopefully later today or early tomorrow, and we'll probably conclude this series in the next 1 or 2 weeks. But I really enjoyed doing it, and I hope you have too. So please like this video on Facebook, share it to friends and family that you know that could benefit from this. And please remember to subscribe to the YouTube channel as well. That would be really helpful, and you can share that with other people. Everybody, I hope you have a great week. I'll see you next time for Wellness Wednesday Live. As always, be empowered.